Hello everyone. Today I am going to discuss an important topic today known as heat stroke. It is one of the common and most dangerous medical condition that occurs in summer season. Heat stroke occurs when the body's temperature regulating system is overwhelmed by excessive heat, leading to rapid rise in core body temperature to dangerous levels. The diagnostic criteria for heat stroke typically include a combination of clinical findings and laboratory tests. Here are the key points. Elevated core body temperature. Core body temperature of 104 degrees Fahrenheit or higher. Central nervous system dysfunction. Altered mental status such as confusion, agitation, delirium, seizures, or coma. Exposure to hot environment. History of exposure to high environmental temperatures or strenuous physical activity in hot conditions. Hot, dry, or moist skin. The skin may feel hot and dry, especially in classic heat stroke or moist in exertional heat stroke. Other clinical signs: rapid heart rate, tachycardia, rapid breathing, tachypnea, low blood pressure, hypotension, flushed skin. Laboratory findings: electrolyte imbalances, elevated sodium or low potassium. Renal function test: elevated blood urea nitrogen and creatinine levels indicating potential kidney injury. Liver function test: elevated liver enzymes (AST/ALT) indicating liver stress or damage. Coagulation test: abnormal coagulation profiles. Prolonged PTAPTT indicating potential disseminated intravascular coagulation known as DIC. Muscle enzymes: elevated creatine kinase levels indicating muscle breakdown, rhabdomyolysis. Absence of other explanatory conditions. Exclusion of other conditions that could cause hyperthermia and altered mental state such as infections, drug intoxication, or metabolic disorders. Diagnosis is typically based on a combination of these criteria, with core body temperature and central nervous system dysfunction being the most critical components. Pathophysiology. Number 1. Excessive heat exposure. Environmental factors: high ambient temperatures, high humidity, direct sun exposure, and lack of ventilation can contribute to heat stroke. Physical exertion. Intense exercise or physical activity in hot conditions increases heat production within the body. Failure of thermoregulation. Sweating. The body's primary cooling mechanism is sweating. As sweat evaporates from the skin, it dissipates heat. Vasodilatation. Blood vessels near the skin surface dilate to increase heat loss through radiation and convection. Heat stroke. In heat stroke, these mechanisms become insufficient due to overwhelming heat exposure or impaired sweating. Heat accumulation. When heat production exceeds heat loss, core body temperature rises rapidly. Once it reaches 104 degrees Fahrenheit or higher, cellular functions and enzyme activities are disrupted. Multi-organ dysfunction. Central nervous system. High temperature disrupt brain function, leading to altered mental states, seizures, and coma. Cardiovascular system. Heart works harder to pump blood to the skin for cooling, leading to increased heart rate and potential cardiovascular collapse. Renal system. This dehydration and heat stress can cause acute kidney injury due to decreased blood flow and rhabdomyolysis. Gastrointestinal system. Heat can damage the gut lining, leading to increased permeability and endotoxemia. Prevention of heat stroke. Here are the salient points for preventing heat stroke. Number 1. Stay hydrated. Drink plenty of fluids throughout the day, particularly water, to maintain hydration and replace fluids lost through sweat. Avoid alcohol and caffeine. This can contribute to dehydration, increasing the risk of heat stroke. Wear appropriate clothing. Opt for lightweight, light-colored, and loose-fitting clothes that help keep your body cool. Use sunscreen. Apply broad-spectrum sunscreen with an SPF of 30 or higher to prevent sunburn, which can affect the body's ability to cool itself. Plan outdoor activities wisely. Schedule strenuous activities for cooler parts of the day, such as early morning or late evening. Take breaks in shades or indoors. Rest frequently in shaded or air-conditioned environments to cool down. Acclimate to the heat. Gradually increase exposure to hot conditions over several days to allow your body to adjust. Avoid heavy meals. Eating large or heavy meals can increase your body's heat production, contributing to heat stress. Number 9. Monitor the heat index. Pay attention to weather reports and the heat index, which considers both temperature and humidity levels to gauge the risk of heat-related illnesses. Never leave children or pets in cars, even windows crack. The temperature inside a parked car can rise rapidly to dangerous levels. Now coming to management. Number 1. Intravenous fluids. IV hydration to replace fluids and electrolytes lost due to excessive heat sweating. Number 2. Cooling techniques. Evaporative cooling. Spraying the patient with a mist of water and using fans to promote evaporation. Immersion cooling. Placing the patient in cool or ice water bath. This is one of the most effective methods for rapidly lowering body temperature. Cooling blankets and ice packs. Applying ice packs to the groin, armpits, neck, and back can help cool major blood vessels. Medications. Antibiotics. Medications like acetaminophen and ibuprofen are generally not effective for heat stroke, since the underlying cause is not an infection or inflammation but an inability to dissipate heat. Benzodiazepines. This may be administered to control shivering, which can generate more heat. Monitoring and supportive care. Continuous monitoring, regularly checking vital signs including body temperature, heart rate, respiratory and blood pressure. Cardiac monitoring for detecting arrhythmias and cardiac complications. Electrolyte management, monitoring and correcting electrolyte imbalance that can occur due to excessive sweating. Renal function, monitor for kidney function as heat stroke can cause rhabdomyolysis. Respiratory support, oxygen therapy. Supplemental oxygen may be provided if the patient has difficulty breathing or oxygen levels are low. Intubation and mechanical ventilation in severe cases where the patient is unconscious or unable to maintain their airway. Seizure control, anticonvulsants. If seizures occur, medications to control seizures may be necessary. Early and aggressive cooling along with supportive medical care is essential to reduce the risk of complications and improve the chances of recovery. Thank you so much. If you like the topic, do like and support. Thank you.